Part 2 is the concussion team model. A school-based concussion team is a way of ensuring that every student who sustains a concussion is monitored for safe return to school and return to activity. And when any kind of health issue affects a student learning, such as cancer or any other kind of medical issue, we know that it's important for people within the school, the teachers, the nurses, the psychologists and counselors, to communicate with each other, but also communicate with medical personnel and with the student's family. It's important that the concussion team members are sensitive to the difficult situations that families may be encountering in the aftermath of a concussion, and that they're strong listeners, that they avoid being defensive if the family is upset about any way that the concussion is being managed, that they recognize fears and frustrations that the student and their family may be feeling, and that they focus on solution, collaboration, and working together toward common goals. This slide depicts potential members of the school-based concussion team. This overall model is designed to be flexible to fit the needs and resources of different schools. So an elementary school team may look different than a high school team. A team of a school that has more limited resources may be comprised of different individuals than a school team of a larger or more affluent school district. But this slide depicts what I would call our typical concussion team members. We have our student and the family at the middle, at the core of the team. In the gray box are suggested academic team members. The teacher, so if it's an elementary school student, it may be one teacher. If it's a middle or high school student, it may be that team of teachers. The school psychologist, the school counselor, a school administrator, and potentially the speech language pathologist. So this list isn't exclusive. There may be other people who are academic team members who aren't on this slide, but this is just an example. The red box are medical team members, such as the school nurse, an athletic trainer, and physician. And then that athletic trainer can also be considered part of the blue box of athletic team members, which also includes the coach, athletic director, and PE teacher. Here are specific roles and responsibilities of each of those core groups of the school-based concussion team. So we said the center of that team was the student and family, and everyone as a team member has responsibilities. So it needs to be communicated to the student that they are a core part of the team member, and they're responsible for clearly and honestly communicating their symptoms, that it's not in their best interests to hide symptoms, particularly if they're eager to get back to activity, to get back to sports and so forth. They need to clearly and honestly communicate academic difficulties and how they're feeling overall, and then also to carry out any other assigned duties that team members give them to the best of their ability. And then the family, the parent or guardian, is responsible for submitting to the school physician notes and instructions to the school in a timely manner. It can be difficult for the school team if they're operating on incomplete information. They also need to help the student maintain compliance with any medical or academic recommendations to promote recovery. Here are a few potential roles and responsibilities of academic team members. This is just a sampling, but the teachers would be responsible for ensuring the student continues to get the best education possible given the circumstances, and overall follow recommended academic adjustments, and continue to provide feedback to the concussion team, especially the concussion team leader, about how those academic adjustments are working for the student. The school counselor can help to create and disseminate academic adjustments to the students' teachers. The school psychologist can assist with that as well and be a consultant for more complex cases where there's an unexpectedly long, prolonged recovery or additional complications. And there may be situations where more long-term adjustments or more extensive assessment and educational plans may be necessary. The school psychologist can be a core part of that process. The responsibility of the administrator is primarily to oversee and to direct the concussion team plan and to troubleshoot any problems. They would also be the person who sets the tone for the presence of the concussion team model and the return to learn process. So they would help create a change in the culture of the school regarding the implementation of concussion-related programs and policies. In terms of the medical team members, the athletic trainer, who also is, of course, a part of the athletic team, would be responsible for evaluating student athletes' possible injuries and making referrals for medical attention. They would also be core members of the team in monitoring student symptoms and helping to coordinate and supervise a student athlete's return to play. So once a student is back to full academics and has completed the return to learn process, the athletic trainer would really be a key leader in facilitating the return to play protocol. They would also be a core liaison in communicating with the school about the student athlete's progress. The physician would be responsible for evaluating, diagnosing, and managing the student's injury and directing medical and academic recommendations. And members of school teams have reported all kinds of different levels of involvement from outside physicians. There are some who will come to team meetings and provide a lot of helpful written feedback, and others who are not as involved in the concussion management process. So one thing that can be very helpful is if the concussion team leader gets assigned release so they can communicate freely and easily with that outside physician to get their input as much as possible in the return to activity process. And then the school nurse is such a key and important part of this concussion team, and they would be crucial for monitoring in-school symptoms and any changes to the student's health status and helping determine if it's appropriate for the student to be at school at all, or if they need a little bit more time at home with full rest. And then when the student returns to school, helping to determine if they need any health-related adjustments. For sports-related concussions, the athletic director is responsible for overseeing the school district's athletic department's concussion team plans. So they would be responsible for making sure the athletic equipment is safe, that there are appropriate policies in place, and that coaches, athletes, and parents of athletes are educated appropriately in concussion signs and symptoms and response. Then coaches and PE teachers or PE directors can be key in helping to recognize concussion symptoms in students who are involved in active play, to remove a potentially injured player or student in gym class from practice or competition, and to be the recipients of communication from physicians and healthcare providers, parents, and the school about a student's readiness to return to active play. This team member would also be key in communicating with the school about the student's progress and whether any additional symptoms have been detected. The concussion team leader pulls this whole process together. This is the central communicator for all team members, and depending on the district, this could be a school psychologist, a school counselor, perhaps a school nurse, administrator, or someone else. It's just primarily important that this is someone who has strong communication skills, is willing to learn new things and take on this role, and really somebody who is available, somebody who is in the school building the majority of days. So this person oversees the return to learn process. They would be responsible for securing the release of medical information that allows that two-way communication between the school and the healthcare provider. So one suggestion of who this identified person might be is it could be the same person as the building's 504 manager or their intervention assistance team coordinator, because this role requires many of the same organization and coordination and management skills and familiarity with interventions and data management and progress monitoring. This slide depicts the overall concussion team process, the steps the team will follow to make sure the student safely returns to school with appropriate adjustments and accommodations. So in the following slides, I'm going to break down these steps in more detail, but as a viewer, you may just want to make note of it and come back to it at the end to pull all of the information together. The first step of the concussion team process is to ensure that the concussion is reported to the concussion team leader as soon as possible. So at the beginning of the school year, that leader's identity needs to be made known to teachers, coaches, parents, administrators, and also to the students and student athletes so that everyone in the community knows who to report injuries to. There are resources such as sample letters that could be sent out that are part of this overall training and overall resources. So school districts don't need to start from scratch in creating these kinds of communications. And then it would be the concussion team's decision of how that information is disseminated to everyone, whether it's in an email blast or a weekly newsletter that goes out at the beginning of the year. But with this first step, anyone in the school community who suspects that a student has sustained a concussion should contact that concussion team leader right away so the student can be referred for a proper evaluation. That concussion team leader would then also review the student's cumulative file to see if there's any documentation of a previous concussion. The concussion team leader would then contact the student and family and meet with the student upon return to school. If it's a young child, the parents would likely also attend that meeting, but if it's an older high school student, it could just be a brief meeting between the student and the concussion team leader when that student comes back to school. So the leader would explain his or her role and give contact information to the student and to the family and explain the steps in the concussion management process. The concussion team leader would also explain the responsibilities of the student and the family. And again, that family communication could occur ideally face-to-face, but also through phone calls and emails, and emphasizing the importance of honest communication, of following recommendation, and sharing any physician notes and relevant documentation with the school. And explaining these responsibilities can help ensure good, positive communication with the family and the student and help facilitate compliance. The third step in the process is to assess medical needs. Ideally, the school would be getting documentation from the healthcare provider who assessed the initial concussion, and that healthcare provider would give direction to the school as far as the severity of the concussion, the symptoms, and recommendations for the school, but this doesn't always happen. So the concussion team leader or another designated concussion team member, such as the school nurse, for example, would determine if the student has been evaluated by an athletic trainer or by a physician, and if there is documentation from that provider regarding any activity restrictions and recommended adjustments to academics, activity, or the school environment. So if no recommendations are available, the concussion team leader or another designated concussion team member should assess symptoms to determine whether the student would benefit from being at school, or if symptoms are so severe that attendance at school is likely to be counterproductive. So one of the resources that is part of this training and that is part of the handbook that accompanies this presentation, as well as links that are available on the website, is a symptom log. That is a simple rating of symptoms, and if the symptoms are significant or severe, the student may need to be sent home. However, if symptoms are manageable and are not becoming significantly worse by being at school, then the student can continue to step 4. And throughout this whole process, the team members are going to document as required. The concussion team leader would get that signed medical release form from the parent or guardian that allows communication between the school and the physician, and would also start a file or folder for the student where all of this documentation can be kept. This helps to track the recovery process for this individual student for this particular concussion, but can also become part of the student's regular record should there be a subsequent concussion. The fourth step of the process is to assess academic needs. So if there are academic recommendations from the physician or healthcare provider, the concussion team leader or a designated team member, such as the school psychologist or school counselor, should specify those general recommendations. However, there often are not such recommendations made, and if that's the case, that concussion team leader or the designated team member should go through the process of assessing the student's academic needs. And there's a form titled Academic Adjustments Concussion that is part of this training. Again, it's in the appendix of the manual and it's provided as a link on the website. And this form goes hand in hand with that symptom log that is the progress monitoring log. So when the symptoms are monitored and the team discerns which are the primary symptoms of concern, they can then use this academic adjustment forms to map appropriate adjustments onto their symptoms. So if there are primarily cognitive or thinking kinds of issues, there are appropriate adjustments that will go more in depth with in part 3 of this presentation. Again, this process would be documented as required, and the concussion team leader would add this information to the case tracking form. The fifth step is for the concussion team leader to distribute academic and environmental adjustments to the students' teachers in writing. They would also contact the family, and if it's a student athlete, they would contact the coach and athletic trainer with relevant academic and medical updates and the written plan as needed. The concussion team leader would also notify other members of the concussion team about the student's status and distribute that concussion symptom monitoring log to any team members who would be responsible for helping track the student's symptoms. The sixth step is to identify an appropriate time frame for reassessment of needs. The student with a concussion may be recovering very quickly and needs may change within a day or 2 days. And using feedback from the teams, especially from the teachers and parents, then they can restart the process at step 3 or 4. So this reassessment of medical or academic needs would occur if there's new documentation from the physician indicating that a new course of action should be taken, if the student's symptoms have changed, if the symptoms have resolved and are no longer a barrier to participating in school, if the teachers or parents have identified problems in the current plan that are not being adequately addressed. And once the reassessment is complete and there's a better understanding of the student's symptom status and a better understanding of how well the academic and environmental adjustments are working, that documentation would be made and the team would then return to step 5, which is notifying the teachers and the parents and the coaches of changes to the plan, and then coming back to step 6 and saying, when are we going to evaluate this again? Just a quick note on student privacy. We need to be mindful that student health information is protected by HIPAA and student school information is protected by FERPA. So members of the concussion team should remind staff members that they should only be discussing what is necessary to manage the situation, and that everyone on the team and everyone supporting the team understands how to appropriately communicate what's involved in a concussion management plan in a way that maintains student privacy. We all know that educators are busy and can often be overwhelmed, and sometimes it's difficult to have yet another new initiative thrown their way. So, here are a few discussion points for gaining support from the school community for the development of a concussion team and return to learn process. And the first point is to just keep the process simple, introducing those key concepts first and gaining support from responsive faculty members. You can create opportunities for open and meaningful discussion and questions and suggestions for improvement to the model. If you promote feedback, that can allow all of the educators and members of the school community to give suggestions on how the initiative can be improved. This is a flexible model, and some of the support documents and steps in the process can be modified and adapted to meet your school's needs. You also want to figure out ways to provide training and ongoing professional development in a way that is easily accessible. And that's one of the reasons that we have these different webinars available, a handbook that can be downloaded, and support documents that are available as individual links. And know that overall, any kind of systems change takes time, and that this is a process. And one of the most key important things is we want people to be talking about concussions, and we want them to be aware of concussions as potentially significant medical events.